My fertility has been a question. It's just been in question for me probably in my early 20s, just in terms of the fact that it just seems such a scary thing, mainly through media, through culture, just always this worry of, okay, if, your biological clock, you never know what's going on with you. How do you know you can get pregnant until you are pregnant, but I don't want to be pregnant until I'm ready to be pregnant. And I think those are all the things that a lot of women wonder. And, you just kind of hope that everything will go well, and you hope for the best. I know personally that because of issues with fibroids with many of the women in my family, many Black women deal with fibroids and a lot of fertility issues, in which have resulted in hysterectomies. So I've always had those really negative things in the back of my mind, probably as long as I could remember. From the first doctor that's telling me, I'm sending you to a fertility clinic if you're not pregnant. It may, marriage may not happen for you. The doctor that's saying your uterus will be Swiss cheese if we try to remove the fibroids. It just created some really negative mental images that I've been fighting to get through. My first appointment with Reply, I was able to, even I'd say just the entrance when you walk into Reply, there are beautiful couches. It was just it was feminine. And it didn't feel cold. Believe it or not, just having that in the beginning as your encounter, it sets the tone. So when I began to talk to my providers and tell them my story, they listened to me. They heard the pain of my story, and they responded and they reacted to that in a way that was professional and in a way that was caring as well. And they were very concerned with how I felt. And I had never gotten that. Normally, I was on the other end of just kind of receiving all of this junk that, a doctor comes in for 5 minutes, they say whatever they want to say, and they leave. And that was not my experience at all with Reply, especially on my first visit. And at the end, after I just kind of laid out my complete story, my doctor said, well, there's things that we can do. This was the first time that a doctor actually said, well, no, there are actual tests that we can run. And just because you have fibroids doesn't mean that it's something that could potentially cause a problem with your fertility. So let's see. It was such a deviation from what all these other doctors had done and what they had said and how they had treated me. It was the first time that I felt like that we were going to work together to figure it out. And that to me was just like the start of my path, that no other doctor had given me. I did not tell Courtney in a romantic way at all. Probably looking back, I should have. But the way I told my husband, I just said, look on the counter. And he is not a morning person at all. So I woke him up early. And so he was probably grumpy that I woke him up. And I just said, look on the counter. And he's like, what is this? What are all these little strips? And he's like, why does it have 2 lots? What is this? And I'm like, we're pregnant. I probably was only 10 days pregnant at that time or something like that. But I was very excited. And what I like about, even with this story, like one of the things that's different with Reply, once I found out that I was pregnant, I called my provider. I called and I said, hey, this is what's going on. I have a positive pregnancy test. And they said, great, come on in and let's start testing and checking your levels. And I know that other doctors won't even see patients sometimes until they're 8 weeks. And so it would have been agony, knowing my history, it would have been agony to wait 8 weeks before I'm able to have any type of, I guess, any type of information on what my body is doing, what my baby is doing. And so I was able to go in and, we ran some tests. We continued to check my levels. They continued to go up, up, up. And, 9 months later, I was able to have my beautiful boy. The main reason that I would recommend Reply to other women is the sheer fact that I just don't believe you're going to get the same quality of care that you would get at Reply. From the time you walk in through the door, to the feeling that you get when you're sitting in the lobby, to actually having the conversations with the doctors, with the nurses, with the PAs, with everyone in all of the staff, even down to having your blood drawn with the people that you're going to talk to, you will be treated with respect. And I think that that is extreme. I think that is important, and I don't think that women get that. I think that being treated with respect means that you're being heard. It means that you are looked at as a partner. And it means that you are looked at as a person that's going to collaborate. And you're not kind of looked down on, but you're looked at as more than just a patient, but you're looked at as a person. And out of the countless numbers of doctors that I have went to in many practices that are very well known in the area, that is not an experience that I had. And it wasn't until I went to Reply that I had that experience. I was empowered to advocate for myself. I was empowered to be myself by the reception that I received when I began to, talk about my issues. And it was encouraged that the doctors and nurses would, listen and get to know who I am and what I need for my care. And I believe that every person deserves that. And I believe that a woman going to Reply would get that.